In order to assess the client's active range of movement in the elbow, I asked them to bring their hands up to their shoulder with their palms facing outwards in anatomical position. I also asked them to do this with their hands in pronation and supination, as different muscles are activated when flexing. For example, with the hand in pronation, brachioradialis would be activated, whereas in supination, biceps brachii would be. And then to assess the client's passive range of movements, I imitate the exact movements myself, asking them to relax and allow me to take the weight and activate the joint. Again, in this video, I use both isotonic and isometric muscle contractions for the resisted testing. Here you can see I'm allowing the client to go through full range of movement, which would be isotonic muscle contraction. I may rate the client's strength levels using the Oxford scale. So here you can see I am doing the resisted testing but not allowing the client to move whatsoever. So this would be isometric muscle contractions. And then lastly, for the functional test, I get the client to perform a press up, which allows for flexion and extension of the elbow. In order to assess the client's active range of movement in the wrist, I ask them to hold their hands out as if they're holding a box, then bring their fingertips towards each other in order to flex the wrist, and then away from each other for extension. I then ask them to bring their thumbs and fingers towards the ceiling for radial deviation, and then away towards the bed for ulnar deviation. Lastly, I ask the client to face their palms up to the ceiling for supination and then down towards the bed for pronation. During this assessment, I'm asking the patient if they're in any pain, and if so, to rate it on a scale of 1 to 10. I then ask the patient to completely relax and allow me to take the weight of their hand in order to assess them passively. In this assessment, we allow for both isotonic and isometric muscle contraction. As you can see here, I'm allowing the joint to go through full range of movement for isotonic, whereas for isometric, I don't let the patient move at all. And lastly, for the functional test, we decided to do the hand grip dynamometer test.